So this is definitely a very unique CEO event, something that we're not used to. It's not like us at ACI to say sit down and put a mask on people. But I want to thank everybody who's attending here today and everyone on Zoom. Hello, welcome to Deshays. I'm going to slip, there we go. We are recording this. So even in here, you guys will receive the recording tomorrow. So we'll make sure to get that to you. And I know there's a couple of people that had to hop off because of certain things with family, whatever's going on, that's fine. Welcome to 2020. So there's a second round of appetizers that's going to be coming out. All of you guys should have gotten 2 drink tickets. You are welcome to take your masks off while you're eating and drinking, but if you get up and move around, please put your masks on and just respect the social distance. For those of you that don't know me, my name is Erica Schwegman, and I am the Associate Director of Membership and Marketing. If you ever have any questions about your membership, the benefits, who to talk to about something, please feel free to reach out to me. I'm always willing to help everybody. We also have Miss Mary Timmons over here, the woman behind the technology for today. She is our tech guru at ACI, and she is in charge of she's our manager of marketing and communications. So those of you on Zoom, I'm going to kind of turn this over to you. And if any of you are hopping on Zoom right now, so you can chat with anybody that's on Zoom, please remember just to remain muted throughout the entire presentation. If you have questions, I'm going to be over there checking the chat feature on my phone so we can answer them. I can call them out for you, so on and so forth. Please note which speaker, if it's Eric or Molly that you're referring the question to, or if it's both, that's perfectly fine as well. And if all questions aren't addressed, we'll make sure to follow up with you again tomorrow. We'll work with Eric and Molly behind the scenes. But today would not be possible if it wasn't for Deshays opening their doors to us. And of course, Pension Corp and Von Lehman, a huge thank you guys. Thank you for sponsoring today. So this would not be possible without you two. So with that, I would actually like to invite Justin and Carrie to come on up and share a little bit about your journey with ACI, a little bit about what your companies do, and how you can support our members. So I'm going to go ahead and step off screen, but I'll come back later. Please refer to people in Zoom too. And if you guys need anything, I will be probably in the back. All right, Carrie. Oh, sorry. I'm breaking my own rules now. Mask up, keep your distance.
No on the mask.
For me to go?
No, I thought I was first. But
Okay,
it did
go
not
ahead, go
matter.
ahead. Absolutely. You said
Yeah, it's
fine.
not matter at all. Can't tell if I'm directly in the frame. Well, hey, everybody. Appreciate you guys being here tonight. I'm Justin Seitz with Pension Corporation of America. I'm a partner at the firm. And again, appreciate you guys being here. We are a proud member of ACI. And a little background on us, just real quick. Most people may know this, maybe not, but we provide record keeping, third-party administration, and investment advisory services that perhaps many of you in the audience or other members of ACI, and for many people in greater Cincinnati area as well as nationally. For those of you not familiar with the things that I just said, what do we do? Well, we deal with qualified retirement plans. This means that we do the government filings. We do the non-discrimination testing. We provide investment services. And we work in tandem with many of you here today and providers like our payroll companies, our accountancy firms. And if that seemed really boring, well, maybe it. We have a passion for it. And this is our passion for 40 years. ACI members, leaders of the community, business owners, and employees of the ACI organization. ACI is critical today, as critical as it was when it was founded in 1929. In times of great trouble, it takes the commitment of leaders and the community to band together in preservation of our free market. In the pursuit of the cohesion of greater society, our community relies on the services that our members provide. As we look at the short run issues, and We have a lot of them right now. Volatility in the market, the current state of the economy, a presidential election, and what may seem like the unraveling of the psyche of the American people itself. We do not forget the long term. And the reality is that the roads will get paved. The critical building of infrastructure will continue, and business will move forward. At PCA, we deeply appreciate being a part of an organization such as ACI. With over 40 years serving Cincinnati, we are committed to our clients, and we have been privileged to watch generations reach retirement. Our supportive journey, helping individuals in this community, this is the purpose of our company. And most certainly, I hope, a small part of the legacy of what we share as members of ACI. If there's anything that we can do for you, your business, your organization, your employees, your community, commitment with you. Thank you for being here tonight. Appreciate it. Braving the elements, braving the mass, being a community. We appreciate that. And I'd like to introduce another of our proud partners, Carrie with Von Lehman and Company. Thank you very much. Appreciate it.
Good afternoon, everyone. Good afternoon. It's kind of interesting to be in person and see people. So, hello, everybody on the screen. My virtual and in-person here. So anyway, good afternoon again. My name is Carrie Richardson. I'm a shareholder and I oversee our construction and real estate industry team. We are so happy to be here today and partner with ACI and PCA to offer this networking opportunity. Our affiliations go back many, many years. And again, just glad to be here today. For those of you that aren't familiar with Von Lehman, we are headquartered in Greater Cincinnati. We're amongst one of the largest accounting firms in the region with over 130 employees. In addition to the traditional tax and audit services that many people think about with CPA firms, we also offer services in mergers and acquisitions, business valuation, succession planning, and state and local income tax, just to name a few. We're proud to serve over 120 construction clients. Many of them are in the room today. And for those of you that aren't working with us, we'd love to see you on our client list one day. The last couple of months have been a time of rapid change all across all industries. And at Von Lehman, we're doing everything we can to stay in front of the changes with tax law changes and everything else going on. If you visit our website, vlcpa.com, you'll see we have a COVID-19 resource center. Our subject matter experts have been staying on top of whether it's tax law changes or changes in the environment. We've got information there for you. We also have free programming that's also located on our website. Again, that's vlcpa.com. Again, thank you for coming today and glad to be here and looking forward to hearing from our presenters.
Okay, we're going to go ahead and have Eric come on up with Cincinnati Children's Hospital. He's going to be presenting a little bit on what the hospitals have going on. So welcome, Eric. Thank you so much for being here.
Hello, everybody. Good afternoon. My name is Eric Zell. I'm a construction project manager with Cincinnati Children's Hospital. My background before I started working there, I was Turner Construction, so I know a couple of you in the crowd, but I've been working at Children's for just under 2 years. And when Erica asked me to speak tonight, she gave me 3 points of how to work at Cincinnati Children's, what's changed with COVID, and what's on the horizon. So starting off with working at Children's, coming from the Turner Blue, it was a little bit of a hard adjustment coming to Children's. Messer and Triversity just, they hold the majority of the contracts, and it's just, so,
There we go.
start with a joke. That wasn't it. So
You can keep that one.
it has been felt like a bit of been on an island, but with these COVID times, it's actually been a real benefit to us with having that committed work group. You know, you talk to these guys, drywallers have been there their whole career, and you know, it's just the blending of the owner to the workers is it's like nothing I've ever I've seen. It's just it's one big team, and it's easy to depend on somebody when they know the system better than I do. So that is a benefit for that. You know, everybody here is used to being adaptable in the construction field. Things are constantly changing, whether it's safety, your weather conditions, and the hospital is no different. You know, it's actually been kind of comforting with all the uncertainty with COVID to know that our infection control experts, they don't know what they don't know the answers on a lot of these things. So, you know, we started off with social distancing where guys were nervous about passing each other in the hallway. Then you can't do construction that way. And it turned out more that we were working on PPE. You know, those guys had to work for hours and hours to try to find goggles that didn't fog up when your mask was over your nose. And, you know, we're working in a building or a system with 16,000 employees that every one of them is looking for somebody to bring some kind of infection into the building and trying to stop that. So, you know, we have people watching us all day long that know the proper way to wear masks, and they will let themselves be heard, and you know that will immediately stop if somebody's not wearing the proper technique. So something else that you know, I'm working with the behavioral health department here at the children, and we started the College Hill expansion project, $100 million project. First week of March, we had our kickoff. That was the last meeting we had in person. We've done every other one in Zoom. I feel like I have a PhD in Zoom now. We've had everywhere from today. I had a couple meetings with 15 people on it, and everybody's just tossing the ball around. We have had meetings with 60 people, and having 60 people in a room during COVID, we've been a poster child with the hospital to keep that. The other thing, children, that doesn't have to do with COVID is the diverse workforce that we have. We interviewed another contractor last week, and there was more talk about the women parts and minority parts of their business than there were about construction techniques or success on other fields. So I challenge anybody to come to one of our job sites and not think that we're a very diverse and inclusive company, because I've never seen anything like it with all the women and minorities that are out there. Some things that have changed at the hospital. June 30th of this year, our revenue was $130 million lower than expected. Majority of that was the non-essential procedures, but our inpatient were down 30%, outpatients 90%. The estimated operating costs for the preparedness of COVID, $7 million. So, we've really put our time and effort into this, with our PPE, our screening stations and everything that we've been trying to do, but the hospital's taken a huge hit on it, and we're recovering, but we're not quite back to normal yet. We're working more from home. I was in the old Ford factory on Lincoln Avenue, and you go up there now, and it's almost like a ghost town. More people are taking their computers home, and but then we also have some people that just can't. The patient cares, that kind of thing. So we have to work around those. So we formed a social distancing committee, and those people tried to come up with, tried all the requests from those 16,000 employees of sneeze guards or, work from homes. They have to funnel those requests and determine which ones need to go or, we need to act on. So, but a lot hasn't changed either. Working in a hospital, we've been ready for infections from, a long time ago, where they're treating this as, kind of normal business where, you're walking. One of the things I had to learn at Children's was the hand washing. You never seen somebody hit that thing more and wash your hands with the Perel, and you're going into every new place you're going into, you're washing your hands again. And that was before COVID, and it's really, it's suited us well for having that preparedness. So, and then our environmental services, they didn't change their cleaning techniques at all. They have increased their frequency somewhat in the areas where the lobbies and where people are at. But, you know, it's been really watching the rest of society really shut down. The hospital's chugging along. You know, when you go to our parking garages, there's less people in there for sure. But the hospital is not shut down. And, you know, it's been reassuring to see the experts push us that way. Coming up next, we're not quite back to normal revenue. We're still in recovery phase, but we have recovered from those 30% inpatient, 90% outpatient numbers, but we still haven't returned to normal revenue yet. Smaller projects, we've definitely cut back on. There's been an emphasis on only pushing projects that absolutely have to happen. But right now, so much money of our capital is tied up in the critical care building tower that, you know, it's not really affected our capital budgets too much. Now some of the projects that are coming up, we have a concept plan of a East Side medical office building that we're putting out on the streets as an RFQ into this year that we plan to have an early 24 occupancy. So that's something that will be out on the streets soon. And then that critical care building tower, that will cause a backfill of $100 million worth of work in the building B that we have currently on site. So Messer's got that contract, but they will be bidding that out to the subs. So hopefully some of you guys can get your foot in the door there. So but, that's about all I have for you. So I guess I'll kick it off to
Say you lost 130 years, specifically, what's gross revenue to go off? To you?
just expect, you know,
I mean, no, what's that number mean in terms of a gross number? What?
Oh, I don't have that number.
You don't have that number. You do. 137 million is a lot. It's
Yeah.
a $1 billion number.
Yeah.
30%. Yeah. So
It's a huge hit on us, but I mean, we've also, you know, there haven't been the layoffs that you see other places. And I mean, it's been really nice working at Children's. I mean, they're just such a steady company that $130 million doesn't shut their doors. So, yeah, to your point. Any other questions right now, or?
Thank you so much, Eric. Molly, who's with Mercy, to talk a little bit more about what we're doing. If you guys would like to develop a presentation, and we preset the presentation to all the faculty.
Perfect.
Welcome, Molly.
So if you guys on Zoom need anything, just flag people that have been on Zoom meetings with me. I use the like preschool things. So I did a PowerPoint, but I can veer. So if you guys have questions, stop me, flag me down. So for those of you that know Mercy, I wanted to put our mission. We are a Catholic nonprofit organization. So our mission is important to us, and our values are really integral to how we deliver projects and how we interact in the markets that we are. If you want to go to the next slide. For those of you that don't realize, Mercy is part of Bon Secours Mercy Health, which is the 5th largest Catholic Catholic healthcare network in the United States. We do about $10 billion a year in net revenue. We have 50 acute facilities, and that represents something like, if I had Matt Crawford in the room, something like 12 million square feet of ambulatory side as well. So we have a large footprint, and that is Bon Secours Mercy Health. And then for me, my role is I support operations through construction management, large and small. I support both acute and ambulatory, and I cover the geographic region that is Cincinnati, Springfield, and all of Kentucky, which is 2 acute facilities and their supporting counterparts. And so design and construction is technically my title. It's like this long. So I focus more on COVID. If you guys want to know more about how to work at Mercy, we're working on our pre-qualification process. That was a 2020 goal, which like everything else, is now laughable and doesn't really matter anymore. So that's in our 2021 pipeline. And then we'll work on subcontractor pre-qualification because we haven't formalized that process in the past. So for COVID-19, I'm going to sort of go through where we started, where we are today, and where we're going both near and short term, and sort of focus on three areas: the projects, continuing operations, and then like shared services, because there's a lot of us that sit in the office side of our group. So if you want to go to the next slide. So where we started, it was one fateful day in March. Some people got the 911 calls from me that we were stopping everything and I didn't really understand what we were doing. As long as we could, if we could maintain an entrance, we could keep going. But like that was edict. And if you want to click the action slide, I also learned a lot about force majeure that day. It was great. And I learned all the legalities of all of that. And then the quick scramble of in the continuing operations, we had to build a bunch of negative spaces. So then there was more 911 calls that went out, and I probably stole some people's negative air machines, and I probably still have to get you some of them back. But it's also interesting, each one of our facilities, our fleet of 50 hospitals, some are old, some are new. There's probably a Dr. Seuss line in there somewhere, but each one had their own problems. Like in Paducah, we were cutting out windows, and there's now fart fans like going out the side that we have HEPA filters in, and other ones we just had to rebalance, and other ones we were able to easily isolate a floor and it was already ready. So it was just that scramble of what do we do? Where do our COVID patients go? All right, we're back. Can you hear me now? I think I got it back. You are muted. Press Alt A. Try now. Can you hear me now? No? Okay, Michelle gave you a yes. Okay. All right. So then support services also went home. There's this beautiful parking garage going on, if anyone's seen it, that no one will ever park in. It's sort of the running joke in our department. Looks great. But so we all went home that day in March. So let's go to where we are now. So where we are now, projects have slowly restarted. We really did not start anything that wasn't already started. So similar to what Eric was talking about, we went to almost a break fix mentality. We shelved a lot of projects, but anything that was started, we restarted. And anything that was compliance related or broken, we started back up. Probably in the last month, I've started things that weren't in those two categories as we're starting to really predict where our incomes will be. We've instituted COVID procedures, which now is an exhibit. I think it's G in our like 15 exhibits in our contract. And then we really brushed up and brought to the forefront our ICRA and PICRA policies, making sure that we actually do it with force. For right, wrong, or indifferent, our infection control wasn't always prevalent in our construction process, and now they are there and everywhere, and they're in our OACs, and just really brushing up what we probably should have always done. Where we are now, another thing in continuing operations is our temp testing sites, which popped up and popped down all over Cincinnati and across the nation. Weird things like making sure you have enough power and making sure that you have thought processes of heat, like we had to shut them down over the summer at Fairfield because by about noon, our clinical staff would get really sick because it would be too hot. And then support services, we're all still working from home. So if we can go to the next slide. I talked about our COVID procedures. Everyone has the PPE guidance. And yes, these are important. They are part of your PPE. We have a chart of when this is acceptable versus your N59s and where we're operating and all of this. If you want to run to the next slide, or temp testing sites. This is one that was at our home office. It's no longer there, but this is something that we've been working through and considering on how to build them and what they're made of and all of that. And next slide. Eric touched a lot about this as well, but working from home in healthcare, you really have to rethink how work is done. You know, we're interacting with essential health with essential healthcare workers. So sometimes they are still there. So I have probably now a third of my meetings in person. I actually have to make sure I here. Oh, no worries. I think we're back. Priya, are we back? Priya's frozen.
Well, it's recording, so you can keep going because I can hear you on my phone.
Perfect. You guys keep blinking in and out from me. So essential workers, we have to interact and be conscious. I have to ask them what they prefer because sometimes they want to be in person, sometimes because it's just nice to see faces, but it's in all of our conference rooms have gotten bigger. And in construction, you have to think of it as a balance because as much as I pretend I can do a Zoom meeting every week, I really have to go look at some stuff sometimes, and how near far, which is this, and then we'll go further. So next year, really, we're going to take 2020's backlog and sort of do it on repeat. I don't think I conceptually estimated a new project for 2021, with the rare exception of we're pumping some ED focused projects, which I'll talk more on. I'm really thinking about how we're working on our ED. So our continuing operations, our temp testing sites, it's winter, like Game of Thrones. So now what? We're trying to figure it out. The other thing with the vaccine prep is what we are understanding from all the different manufacturers is this vaccine has to be kept extremely cold, and we probably want it on generator backup so we don't ruin a batch. So do we have enough capacity? Where are we putting these vaccines, et cetera, is an ongoing topic that I'm not always you saw the big thing, but I know it's going on. Guess what? Support services, we're still working at home, trying to figure this whole thing out. And our EDs, we're really looking at how do we separate our patients when they present with some respiratory symptoms. And a lot of our physicians are also giving us the feedback that we probably should have done this during most flu seasons anyway. So this is something that, although it was brought on by COVID, we're really looking at how we deal with the big flu season anyway, because it's a very similar case. And so could we do better in our ED? So whether we're expanding out and dividing, that Vishal's doing for us right now, or this other one that we're working on getting out, which is literally, we're just rebuilding some little walls to build a respiratory waiting space that goes straight into our triage space. So some of those, I have one almost in every project. Some of them are cutting holes, some of them are bigger. So with the next slide, the working from home, I'm just going to put this out there. I might have wanted to put a picture of one of my kids. For those of you that don't know, I'm a very proud mom of 4 kiddos, but it's also a real thing that your people are working from home, and it's insane some days. Like right there's toilet paper and a coffee and a baby sitting on my lap, but they're also going into winter and people's kids may or may not go to school anymore. So it's just real that I have touch-ins with most of my team members and asking about just basic things like, is your heater coming on? Are you getting good internet? Are you what's going on in your world? Have you talked to enough people? And really being in tune with the whole mental health part of working from home, because it's bananas some days. So that's part of why I want to put that slide out there. So where are we going long term? We're really looking at pandemic ready, and what does that mean? Pandemic ready of what we did in March, like a wildfire, we really don't want to do again. We need to think about in a heavy flu season or in a heavy anything else, how would we convert a hospital? They actually did studies beforehand. There was only 2 pandemic ready hospitals before all of this. And so now we're all sort of scratching our heads. And then Eric talked a lot about the reduced income. That's very real and is going to probably continue for a while. We also have within the adult population, payer mix is changing because people are unemployed. So we really are looking at the ROI of design. Is this efficient? How do we make sure that we're not building a design that makes our staffing harder? or we're putting in mechanical systems that are penny wise, pound foolish because they chew up in operating costs or rinse and repeat. Continuing operations, I probably should have put just virtual everything with healthcare. This has really opened everyone's minds to like, why are we doing it this way? So we're building med office buildings the same way we always have, but we're all starting to talk about what does telehealth mean and should we be doing that? I was on a call today about, where should the pulmonologist sit? Should they be in every hospital or should we have a pulmonologist place to be? So in continuing operations design in general, that's some of the things that we're thinking about. And then support services, I spoke about how many square feet of ambulatory space, but legitimately we have offices all over the United States and Ireland. And how do we get back in the office? We built these great offices for casual collisions, which are horrible in pandemic. So how do we get back? So that's a task force that we honestly still haven't figured out. I think it's something we just keep kicking the can because we're really focusing on our clinicians and the rest of our people. And I think I left things for questions.
Any questions for either Eric or Molly? You guys can go ahead and shout them out. And then I'm also watching chat too. So
Perfect.
Okay. Any questions?
I have a question.
Yeah.
For Eric or Molly, you mentioned you kind of touched on telemedicine. I'm curious as to get you guys' opinions on how much that's going to take traction in the future. I mean, this is an opinion because you guys have some studies, so I get that. But it seems like, more touches, I know from my perspective of having teams across a region, it seems like I touch base with them more often. Now it's nicer to be in person, but I do touch base now more often because of necessity of communication. I'm curious as to, is that going to be like something that you think that will take some traction of like touching base with your doctor more often? And remotely.
So I can say there's two topics you talked about, like working from home. Some reason I am on more meetings than I was quadruple booked at one point today, and people have lost the ability of looking at my calendar. But I would also say, like, on the telehealth medicine, I think it's something we all wanted. I will say I'm a token millennial and a mom of 4 kids. Do I want to pack them all in the car to go take someone to the doctor for something I obviously know is pink eye? No, like not at all.
Yeah.
So if I could just Zoom and say, like, can I just get a prescription? That'd be great. Yeah. So I think it's also things like if you're in your doctor's office, you might then telehealth with like a specialist versus like getting in your car and driving across town. So I think I think it's a whole brave new world. And this was a disruption that was always happening. There were some laws that kept it all in place that's all sort of fallen apart because of you had to. So.
Yeah, we had more telehealth visits the first month of COVID than we had the whole year before. So right away, that was a huge kind of a shock to us. And that east side building that I talked about was we were in the planning stages for that, and we halted everything so that we could kind of regroup, catch our breath, and kind of see what this COVID was kind of all about. So we're back into planning. Telehealth, I mean, everything I hear, it's going to be a huge future with the medical community. And then from my perspective as a construction project manager, it's been godsend. I just love being able to jump from meeting to meeting. I mean, my schedule is so much more packed than it was earlier, but I was spending a lot of time riding around buses from our different sites down at the base. So I think it's a more efficient use of my time. But the job gets built out in the field. So you have to make a physical effort to get out there and see what's going on and connect with those people. So it's going to be a balance. So I think it's going to be all that on the team side.
Additional questions?
Yeah.
What is the realistic plan that video percentage, 20%, or even realistic values also on you guys see that in your work?
My guess is that we're trying to build more of a generic spaces versus the dedicated to certain specialties. We're going to be doing more of the office that can switch between specialties. different days of the week. But other than that, I think you make a lot of money if you had that crystal ball on a lot of things of being able to say exactly what was going to happen. But the multidisciplinary spaces, I think, is going to be the future for us.
For us, there's a whole task force of figuring out what to do with our $12 million square foot that I cannot even speak to. So that is Matt Crawford's baby. But it is an impact. Some of it is also like, we're like every other owner. We own a lot, we lease a lot of square footage and we can't get out of it even if we wanted to right now. So some of it is we are forced to pause because of leases that we have executed across the ministry and in every market. So.
Any last questions? All right, well, first of all, Molly and Eric, thank you guys so incredibly much. Again, thank you guys for being here, and for those of you that were able to join us on Zoom, hello. I'm so sorry for the technical difficulties again. Thank you, 2020. But thank you guys all for being here. Please feel free to continue sitting at your seats and mingling a little bit. And thank you again to Pension Corp of America and Ron Lehman for sponsoring. Thank you guys very much.